8 symptoms of colon cancer that will shock you. Many people are surprised to learn that colon cancer is one of the most common cancers worldwide, yet its early warning signs are often overlooked or misunderstood. Despite advances in screening and treatment, thousands of people are diagnosed each year only after the disease has already progressed. What makes colon cancer particularly concerning is how quietly it can develop. In its early stages, the symptoms may seem mild. They may appear unrelated, and in many cases, they are easily mistaken for common digestive issues. Now imagine this for a moment. By the time you finish watching this video, you may begin to recognize several warning signals that millions of people dismiss every single day. Signals that your body may be sending long before a diagnosis is ever made. Colon cancer is considered one of the most treatable cancers when detected early. However, once it spreads beyond the colon, treatment becomes far more complex. The 5-year survival rate can exceed 90% when the disease is caught in its earliest stage. But that number drops significantly when diagnosis is delayed. Every year, more than 1.9 million people around the world are diagnosed with colorectal cancer. And unfortunately, a large portion of these cases are discovered too late. Research suggests that many patients ignore early symptoms for months, assuming they are related to diet, stress, or minor digestive discomfort. But here is what many people do not realize. In numerous cases, the body begins sending warning signals long before the disease becomes advanced. The problem is that these signals often appear subtle and easy to dismiss. They hide within everyday changes that most people would never associate with something serious. Your colon, also known as the large intestine, plays a vital role in digestion. It absorbs water and nutrients from the food you eat. It also helps form and move waste out of the body. When this system is disrupted, even slightly, the effects can show up in ways that may seem unrelated at first. Another challenge is that the colon does not always produce pain in the early stages of disease. This allows abnormal growths to develop quietly over time. That is exactly why understanding the body's warning signals becomes so important. The more familiar you are with these signs, the greater your chance of recognizing when something is not quite right. In this video, we will explore 8 surprising symptoms that may be associated with colon cancer. Some of these signs may seem minor. Others may appear occasionally and then disappear. In fact, several of them are so common that many people experience them without ever suspecting a deeper cause. You might even recognize 1 or 2 of them in your daily life. Interestingly, recent studies suggest that recognizing a combination of these symptoms may significantly improve the chances of early detection. Disclaimer: this video is created for educational and informational purposes only. It is not intended to diagnose, treat, cure, or replace professional medical advice. If you notice unusual symptoms or have concerns about your health, always consult a qualified healthcare provider. Now, let's begin with the first warning sign. Sign number 1, changes in bowel habits. One of the earliest signs of colon cancer often involves noticeable changes in bowel movements. You may experience diarrhea, constipation, or a sudden shift between the two. At first, these changes may seem temporary. Many people assume they are caused by diet, stress, or minor digestive upset. However, when these changes persist for several weeks, they may indicate that something is affecting the normal function of the colon. A growing tumor can interfere with how waste moves through the intestine. This can alter the frequency, consistency, and pattern of bowel movements. Some individuals notice that their routine suddenly becomes unpredictable. This inconsistency is often one of the earliest clues that the digestive system is not functioning normally. Sign number 2, blood in the stool. The presence of blood in the stool is a symptom that should never be ignored. Sometimes the blood appears bright red. In other cases, the stool may appear dark, almost black. This color change can occur when blood has been partially digested as it moves through the colon. Bleeding may result from tumors that irritate or damage the lining of the intestine. Even small amounts of bleeding can become noticeable over time. Many people assume that blood in the stool is caused by hemorrhoids. While that is sometimes true, persistent or unexplained bleeding always requires medical evaluation. Sign number 3, abdominal discomfort, or cramping. Colon cancer can cause ongoing discomfort in the abdominal area. This discomfort may feel like cramping, bloating, or a dull ache. Unlike occasional digestive discomfort, this sensation tends to persist or return frequently. Some individuals describe a feeling of pressure or fullness in the abdomen. This can occur when a tumor partially blocks the passage of waste. Gas may build up behind the obstruction, creating a sensation of tightness or swelling. Because these symptoms are common in many digestive conditions, they are often dismissed. However, persistent abdominal discomfort should not be ignored. Sign number 4, a feeling that the bowel does not empty completely. Another subtle but important symptom is the sensation of incomplete bowel movements. After using the bathroom, you may still feel as though something remains. This feeling can persist even after repeated attempts. It may create a sense of urgency or discomfort throughout the day. This occurs when a tumor interferes with the normal emptying process of the colon. The body senses that waste is still present, even when little or none remains. Many people find this symptom frustrating and confusing, but it can be an important signal that something is obstructing the normal flow within the intestine. Sign number 5, unexplained weight loss. Losing weight without trying is a common warning sign in many types of cancer. With colon cancer, this can happen gradually over time. The body begins to use more energy to support the growth of abnormal cells. At the same time, digestion and nutrient absorption may become less efficient. Some individuals also experience a reduced appetite. Food may feel less appealing, or eating may cause discomfort. These changes can lead to a steady and unexplained drop in body weight. Sign number 6, persistent fatigue. Fatigue related to colon cancer often feels different from normal tiredness. It is not simply the result of a busy day or lack of sleep. Instead, it is a deep and ongoing exhaustion that does not improve with rest. One possible cause is chronic blood loss from the tumor. Even small amounts of bleeding over time can lead to iron deficiency anemia. When the body lacks enough healthy red blood cells, oxygen delivery becomes less efficient. This can result in weakness, dizziness, and persistent fatigue. Many people initially attribute this feeling to stress or aging. However, ongoing fatigue without a clear cause should be evaluated. Sign number 7, narrow or ribbon-like stools. Changes in the shape of stool can also provide important clues. Some individuals notice that their stool becomes thinner than usual. It may appear narrow, almost like a ribbon. This change can occur when a tumor reduces the space inside the colon. As waste passes through the narrowed area, it is compressed into a thinner shape. While occasional variation in stool shape is normal, persistent narrowing should not be ignored. It may indicate a structural change within the colon. Sign number 8, nausea or vomiting. In more advanced cases, colon cancer can interfere with the normal movement of the digestive system. This can lead to symptoms such as nausea or vomiting. These symptoms may occur when the intestine becomes partially or fully blocked. Food and waste are unable to move forward as they normally would. As pressure builds within the digestive tract, the body may respond with nausea. In severe cases, vomiting may occur. While these symptoms can have many causes, persistent or worsening nausea should always be taken seriously. Understanding these 8 warning signs of colon cancer may help you become more aware of changes in your body. Recognizing these signals early and seeking medical advice when symptoms persist can make a meaningful difference in early detection. If you found this information helpful, consider liking this video and subscribing for more science-based health insights. There are more videos on your screen that explore important health topics you may find valuable. Your support helps bring life-saving information to more people around the world.